Did you know that the Veterans Health Administration, or VHA, is the largest integrated healthcare system in the United States, providing care at 1,380 healthcare facilities, including 170 VA medical centers and 1,193 outpatient sites, to over 9.1 million veterans enrolled in the program? It's truly a national resource for our deserving servicemen and women, but like so many other things right now, it's under attack by the Trump administration and Elon Musk, and yes, the Doge boys. Hey guys, my name's Will, and this is the Back 40. Let's talk about it. VHA medical centers provide a wide range of services, including traditional based hospital services like surgery, critical care, mental health, orthopedics, pharmacy, radiology, and even physical therapy. They utilize community-based outpatient clinics, or CBOCs, across the country, and they provide the most common outpatient services, including health and wellness visits, and they do that without the hassle of trying to travel a long distance to a medical care center. And they've included more and more of these CBOCs in rural healthcare approaches so that veterans living in rural areas don't have to travel as far to get these services, and they extend to the end of life. They provide skilled nursing facilities, referred to as nursing homes, and they support veterans with chronic stable conditions like dementia, rehabilitation, and those that need end-of-life care. They also provide a variety of care to veterans who suffer from a wide range of medical, psychiatric, vocational, educational, or social programs and illnesses in a really safe home environment through their domiciliary program. The VA is committed to ensuring veterans receive high-quality, specialized care tailored to their unique needs. And this includes for things like traumatic brain injuries, PTSD, and many other services and conditions related to military service. And they have access to comprehensive mental health support, cutting-edge treatments, and innovative research, all through the VA, through telehealth services, home-based care, and a strong network of providers. And the VA is doing all of this while continuously trying to expand their services. Now, the VA's effectiveness is being brought under question by Doug Collins, the new VA secretary, as well as other parts of the department. And they're trying to claim that the VA healthcare services are a swamp-filled bureaucracy of waste, fraud, and abuse that can't be trusted to provide quality healthcare to our vets. Now, what we do here in the Back 40 is interject actual facts into the conversation, so let's do that. Do you know the VA works hard to survey its veteran population with nearly 2.8 million annual responses received every year? And the VA's average response rate for its healthcare and benefits-focused surveys is 18%, and that's higher than the industry average in privatized healthcare. So our veterans are making their opinion known, and they aren't shy. According to surveys in 2024, 92% of veterans said that they trust the VA healthcare system. That's a 25% increase since 2016. In addition, VA hospitals consistently outperform non-VA hospitals in these areas. And in the most recent Centers for Medicare and Medicaid Services Hospital Consumer Assessment, 79% of VA facilities got a 4 or 5-star ranking. That's a 39% greater performance than privatized healthcare. And that marks the 9th consecutive quarter in which VA facilities have outperformed non-VA counterparts. And they processed 127.5 million healthcare appointments in 2024. Wait times for medical services, a major indicator the VA tracks, have decreased, while private hospitals have seen a huge increase. The VA remains the gold standard for veteran healthcare, offering specialized services tailored to veterans' unique needs, care that private hospitals can't replicate, all of which blows a big hole in the VA secretary's waste, fraud, and abuse myth that they're forwarding to privatize healthcare. Project 2025 seeks to dismantle the Veterans Health Administration. If the Trump administration, Doge, and VA Secretary Collins have their way, they will push veterans into an outsourced care model, a privatized model, and the entire VA healthcare system will be at risk. Lost funding for VA hospitals will occur, leading to closures and staff shortages, and we're already seeing that. They're trying to get employees to quit through the fork in the road effort and outright firings at the VA. Furthermore, privatization will lead to for-profit healthcare providers replacing VA doctors, even in VA facilities. And the privatization of healthcare facilities at the VA means that rural veterans will lose the most, because rural healthcare, private healthcare facilities don't have the same focus on veterans that VA hospitals do. The VA wasn't built to just generate profits at the risk of providing good healthcare to veterans. They're there to primarily provide healthcare for veterans. That's their number one priority. And according to veterans, that's what they're doing right now. So in the next video, we're going to discuss the overall rural healthcare crisis in America and the risk it poses to our rural veterans, and why right now we can't afford to see the primary healthcare structure for veterans in this country taken away. In the meantime, I'm going to ask you the same thing I asked you to do in my first video about VA healthcare. If you see a veteran, thank them for their service, and do everything you can right now to reach out to your elected officials to tell them to have Elon Musk and the Doge boys keep their hand off of veterans' healthcare. Hey guys, this is the Back 40. I'm Will, and I hope you have a great day.